Do you think the NHS is in crisis? And also this changing demographic, if it isn't in crisis now, are we, with the demographic bulge from the boomers kind of era, is that coming along and we're not talking enough about it?
I don't know. I think probably everyone who works in the NHS, if they were asked that question any time in the last 30 years, would say yes. I think it's a perma-crisis, or at least the culture has been created that everyone believes it's a perma-crisis. Obviously, Wes Streeting walked into 39 Vic Street and said the NHS is broken, which had a mixed response amongst the people working in the NHS. I do think that politically there have not been many honest conversations with voters and taxpayers. Again, before we press roll here, you talk about the demographic, the demand increase just from population size alone. And inflation alone does things to health budgets that people will find unpalatable if we don't have a larger pie, either from growth or from taxation, that we can carve out that health budget. The secondary thing is the population demand. So that the bulge, if you look at a population, I can't remember what that graph's called with the bars, for Britain, you see this bulge in the boomer age category. And we are getting really good at keeping people alive in complex states, and that's incredibly expensive. When the NHS was founded, retirement age was 59, 60, and the life expectancy of a man was 64. Retirement age is now 68, and the life expectancy of a man is the early 80s. That only places pressure on things like the state pension system and a range of other public services which people access after they cease to become a working taxpayer. But the complexity of the health requirements in those years of your life are just so much more. In Wiltshire, we have a growth demand projected of say 4% for the next year. But that comes almost exclusively from the cohort that requires loads of healthcare. Like, I don't mind if I have a 4% growth in my population for 25-year-olds, because they're very, very unlikely to need the expensive interventions of a hospital. When it's all coming from the 60 to 80-year-olds, they're very highly likely to come and see us, unfortunately. So it's in I don't know if I would use the word crisis. It's definitely in a position where, as a public service, a more honest conversation is needed around, if we want to continue to deliver care in this way for this many people, we're going to need this kind of resource to do it. Or, and this is one of the reasons why I wrote the book, we're going to need to conceive of radically different ways to do those things and deliver that kind of care.
So what do you think these innovation areas will be or should be?
My personal experience and love and hope in that regard is, or my pet passion, I suppose, is cross-sector innovation. So I think if the NHS, as much as we've got the difficulty of spreading between silos and adopting proven innovation, I still think if the NHS had the answers itself, it would have found them. And the thing that requires real humble leadership is the NHS to go, I don't think we can do this ourselves. I don't think we know how. And certainly I think that the way that leadership has developed in the NHS over the last 10 years and the competitive environment that used to exist, I don't think that the leaders have been set up in their development for this kind of thinking. So I think it's a case of looking for answers where we would never have looked for them before. So I talk a little bit about in the book the Future Hospitals Initiative, which was a collaboration between the European Space Agency, UK Space Agency and Hampshire Hospitals when their new hospital programme was getting started. And that was a collaboration that we anticipated would yield literally no interest. The question to the space sector was, what of your skills and capabilities can you bring to bear for the development of a new hospital and its services? And we expected radio silence. And instead, we got tens of world-first ideas. Some of them are not directly related to solving the grand challenges of the NHS, right? But some of them were pretty good. The blending of space data and terrestrial data with the advanced computational skill that often exists in big data industries like the space sector, to look at population health differently, right? So what we can't do is, we know where people are experiencing bad outcomes, often in more deprived areas, and we are sort of sometimes able to go and do stuff like go and run a lipid clinic in one of your poorest areas, or put on extra resource to be in touch with communities that don't otherwise access health services. But we're not very good at tracking those interventions. They're not very real time. They often rely on census data or annual data. So there's capabilities from that particular project example where satellite data was helping with a much more real time tracking of population health intervention. no one had thought of that.
Yeah.
And there were a range of other examples like that. So when health looks to other sectors that it maybe has never thought of partnering with before, defence maybe being one, I don't know, there'll probably be stuff there. What that requires in a behaviour way is a bunch of leaders to go, I have no idea if there's going to be these answers out there, but I'm going to go and try anyway, while at the same time as those leaders are asked to manage incredibly pressured services with limited resources, where the time to do that is either not available or will be viewed a certain way. So, not easy.